One of the most important aspects to the role of the stoma care nurse is the sighting of your stoma. And especially in the early discussions, whenever you're meeting your stoma care nurse for the first time, he or she will talk to you about where the stoma should be sited. And you may well have your ideas that you think it should be here or there or somewhere else, but listen very carefully to what your stoma care nurse is saying. There are rules of where the stoma should be sited. If you think about your abdomen, and if you look at where your tummy button or your umbilicus is, and if you look at your hip bone, it should be positioned halfway between those 2 points. And it's really important for the stoma care nurse to look at your whole body. And she must look at you where you're sitting, standing, bending, to ensure that the stoma is actually sited in an area that is away from your waistband, that it is away from your abdominal wound, that it is away from any creases or wrinkles or scars that you may have on your tummy. And she will do that standing, bending, sitting to ensure that she achieves the position of your stoma in the optimum area. And by having your stoma sited, it really should help to eradicate any post-op problems such as leakage or pouch adhesion difficulty, especially if it's maybe positioned too close to your abdominal wound or too close to your hip bone. Now, it is a science and it does take a bit of learning for your stoma care nurse to be able to do that. But if you work with them, you wear your own clothes and your own trousers if possible whenever the stoma nurse is siting the stoma, so that you can have it in a position that's going to be comfortable, that's going to prevent any problems, and it means that you're going to be able to live your own independent life following your surgery. Whenever your stoma care nurse then has sited your stoma, and perhaps it is maybe a few days before your operation, she may well give you a pouch to try, and it's really important to put that pouch on to ensure that whenever you have the pouch on your tummy on this chosen site, that it actually will work for you, because the pouch, the actual site of your stoma can be changed ever so slightly beforehand, but whenever you have gone through your surgery, that position of your stoma can't be changed.